Welcome, September 2023, and another great issue of Pediatric Critical Care Medicine. I'm Robert Tasker, your Editor-in-Chief, and my editor's choices this month are about pediatric acute respiratory distress syndrome. It's been a hot topic this year, 16 papers so far, and I thought I would focus on 3 more from this month. The first highlight is by Emero and colleagues on non-invasive ventilation used in the PARDI dataset from 2016 and 2017. Out of those 708 patients, there are 160 who underwent non-invasive ventilation. Just to give you a bit of context, we had the PALIC-1 in 2015, where this was much debated. PALIC-2 in 2023, where there was still an ongoing debate, a systematic review and meta-analysis published earlier this year in PCCM, and a concise physiology review on the topic. So do read the paper. There's an accompanying editorial which calls this analysis a game changer. My second article to do with PARDS is by Ardila and colleagues. They have looked at biomarker trajectory for non-pulmonary organ dysfunction in patients with ARDS. And for this work, they used the BALI and the RESTORE datasets from 2009 to 2013, 350 patients with PARDS, and they've looked at the trajectory of developing organ dysfunction along with inflammatory biomarkers. Very interesting stuff. I think for me it brings in context this inflammation shock PARDS continuum, and I hope that there can be some connection with the dynamic modeling that we're hearing about in other pieces of work. The third article is by Crucis et al., and this is about lung resistance in PARDS. And this is a detailed study in 16 patients looking at plateau pressure and driving pressure in patients undergoing volume and pressure controlled ventilation, and separating out frictional and viscoelastic components of lung resistance. For me, I think it's useful to have some detailed physiology with the epidemiology. And then in the PCCM connections for readers, I focused on biomarker reviews. The first is about severity of illness and looking at the lactate-albumin ratio as a component variable rather than the a compound variable rather than the individual components and their relationship to outcomes. The second type of biomarker is a severity of oxygen exposure and looking at that relationship with outcomes in over 3,000 mechanically ventilated patients. For me, I think this speaks to the much anticipated PICU study that we know is completed, and we want to see the results of that. So rather than just hearing about associations, let's see what difference actual oxygen targeting makes. And lastly, a severity of ferritin level in dengue, sepsis, and outcomes. Again, an interesting study that ties back to work that we published last year in PCCM to do with ferritin and outcomes. So collectively, a very interesting month to read. Do enjoy, and there's going to be more on PARDS later this year. So I think it's the topic of the year. Thank you very much for your attention. See you next month.